My name is Jenny Brodie, as she noted, and I'm a policy analyst with Innovation Ohio. Myself and the other women here today feel like it's time to speak up and to push back on the lies being told about healthcare in both Washington and Columbus. The Affordable Care Act is the law of the land, and unfortunately, politicians here and in Congress have chosen to throw up roadblocks and to encourage scare tactics rather than helping their constituents. They're doing this when they, as Stephanie noted, when they should be explaining the basic services of the law to their constituents. Representative Clyde and Stephanie have outlined some of the important aspects of the Affordable Care Act and how it impacts women's health. They've also touched on the political context. I'd like to bring to your attention a study that Innovation Ohio did regarding how much more women pay for health care coverage based solely on one fact, and that's their gender. The Affordable Care Act will end this discrimination. Our research showed, just a few takeaways from our research, a typical 40-year-old woman in Ohio buying an individual policy pays anywhere from 20 to 50% more than a 40-year-old male. 60% of the insurance plans sold in Ohio charge non-smoking women higher premiums than men. In addition, it not only drives up the cost on the individual market, but it increases the group insurance costs for many small businesses, particularly small businesses that employ a large number of women. Now, other states have chosen to ban this on both the individual market and the group insurance market. But here in Ohio, last General Assembly, there was a bill introduced to end this practice, and it was not passed. The Affordable Care Act, though, will solve this problem, and it'll make it so that gender discrimination in insurance pricing is no longer. Now, while the Affordable Care Act will make health insurance more affordable in this way, there's also the issue of pre-existing conditions. Obamacare also makes the practice of not providing insurance for someone with a pre-existing condition, it ends that practice as well. So I wanted to tell you my personal experience with the pre-existing condition part of this law. I have a heart condition. It's called Marfan syndrome, and I've had it my entire life. Prior to the Affordable Care Act, there were absolutely no options for me on the private market. Shortly after college, I worked several part-time jobs, and I tried to buy my own health insurance on the individual market, and I was turned down by every company that I contacted. The condition that I have is automatic rejection for most insurers. So in my attempt to be responsible and make sure I was covered, no one would cover me. Now I was able to stay on my parents' insurance at the time. Fortunately, I was young enough, and the laws have changed, which makes that even easier. But currently, were I to take a job that doesn't have a group plan, I wouldn't be able to be insured. So I couldn't work for many small businesses. I couldn't start my own small business. I couldn't be self-employed because I wouldn't be able to insure it. Fortunately, the Affordable Care Act changes this and makes it so that I can't be turned down simply because of a medical issue which I have no control over. This is the type of information that I feel like Congress and our politicians here in Columbus should be sharing with their constituents. They should be making sure that their constituents are aware of these changes and how these changes will help them and impact their life on a daily basis. So we need to stand with women in Ohio and tell our congressmen and elected officials that they should be educating their constituents. Thank you for joining us today. We'd be happy to take a few questions.